Welcome to America's Heroes Group.
Hi, I'm Ken Jennings. All of us here at Jeopardy want to thank you for your service to our nation. We truly honor and appreciate you, and what's more, we're looking for contestants like you to play on our show. So head to Jeopardy.com now and take the Anytime test, and we're looking forward to seeing you soon right here on the Alex Trebek stage.
And with that, welcome to America's Heroes Group. This time on the roundtable, we are globally connected with KFF Health News. Today is Saturday, November 18th, 2023. This Thursday is Thanksgiving Day, and we wish a special Thanksgiving to all those veterans overseas serving and also all the veterans out there across this country. November is Military Family Appreciation, National Family Caregiver, and Alzheimer's Disease Awareness Month. Our host is Cliff Kelley. I'm Sean Claiborne, the co-host. Our executive producer is Glenda Smith. Our digital media producer is Ivan Ortega of Scout to Honor Productions. And of course, we have our panelists with us as Stephanie Stapleton, KFF Health News Senior Editor. She has 20 years of experience covering healthcare. She has been with KFF Health News since its launch in 2009. We're going to talk about her article, KFF Health News and PoliFact staff article, Another GOP Primary Debate, Another Night of Verbal Clashes. How are you doing today?
I'm doing well, thanks. How about you?
Pretty good. So tell us, what was it? Give us an overview of the debate from what you saw. Just real quick.
To me, quickly, it was a clash, and people were definitely fighting it out. I was watching the healthcare issues closely, and in that regard, the people on the stage, the candidates, were definitely putting out there where they stood on abortion, and certain candidates were challenging the others to be more clear about what their position would be. And then the candidates also touched on a few other health-related issues as well.
Okay. So more specifically, we talked about abortion. What other topics were discussed?
They talked briefly about, they brushed up toward entitlement reform. In fact, it started off, Kristen Welker, who was one of the moderators, was pressing the candidates to talk about, if there was going to be an increase in the age of Social Security eligibility, what exactly would that age be? But that really is a difficult thing to pinpoint because there are a lot of factors that go into that calculation, and none of the candidates would really reveal that exact age that they would consider. But instead, they sort of started talking about other things, just very lightly, though, and they, such as Medicare and like getting Medicare back into fiscally sound shape and, some things like that. But again, they were very light on policy, more just sort of saying like, yes, we need to think about this kind of.
So no deep dives into real policies and no deep dives into real issues, it sounds like.
I would say, Nikki Haley at one point talked about the need to beef up Medicare Advantage plans more. But again, those are expensive. Those cost the Medicare program money. They're very popular with beneficiaries. So that sort of, again, highlighted what I guess is one of the challenges that the Republican candidates are facing with the budget in general. As much as they want to rein in spending, they keep targeting the discretionary spending. But that's those aren't the big line items on the budget.
Right.
But on the other hand, it's hard to talk about changing Medicare. And I think that was revealed during the debate.
So which candidates, in your opinion, I'm going to go down a list of different things, but which candidates shine of the people that are on the list?
I think everybody had some moments. I think, if you listen to the broader discussion about the debate that came afterward, I think, Nikki Haley definitely gained some points. And again, on the abortion question, which is another point that I feel like the Republicans are struggling with on their messaging right now, she was the one that reiterated how personally she is very opposed to abortion, but she said, I want to be realistic. And she was saying, like, right now in Congress, there are not votes to pass a national ban. So, she was saying we need to think about things that are compromises or that we could build consensus on. which that seems to be something that might gain some popularity down the road. But then other members, like he has now stepped out of the race, but Senator Tim Scott, he was the one that was very firm of like, I believe that we need to have a 15-week national ban. And he challenged both Nikki Haley and DeSantis to meet him on that, and neither one would jump onto that policy challenge. So, you know, that like on the abortion question, that was sort of where the give and take is. It's like, do you support a national ban, you know, or how do you go forward from there?
Who do you think was most prepared on the panel?
Oh gosh, you know, I think. Well, I would say that they were all very prepared. They were ready to talk about different things, you know, and in some cases they were battling it out, trying to grab the spotlight, you know, because in that debate, let's remember, the former President Donald Trump is the front runner by miles and miles, and he was not on the stage.
He's notably absent on top of that.
Yeah,
which
so
is really
the
ironic,
people that were there were just trying to grab a little bit more momentum for themselves, I think.
So who communicated the best out of the group, would you say?
You know, I would go back to, I thought that Nikki Haley did well. I mean, and that is just my opinion, and I'm not necessarily a political reporter, but, you know, I do follow it, and I, you know, was doing some coverage for us. And I think the polls after the fact and the coverage after the fact reflected that as well. I thought, you know, all the others had their moments.
Who was the most attacked? Was she the most attacked, or someone else most attacked?
I think that she did seem to be, you know, there were a lot of flare-ups. I think she and Ramaswamy had a couple pretty intense flashpoints along the way. I think Ron DeSantis also was under attack at different points, and I think that I think it sort of depended on the topic and how they were sparring. But again, back to what I said earlier, the real point was all of those people on the stage were trying to grab some of the spotlight for themselves, you know, because they're fighting for second right now.
So since Trump wasn't there, he was noticeably absent. Where was he at that time?
Oh, he had some counter programming in nearby Hialeah, Florida. The debate was held in Miami, and so Trump, the former president, had his own rally in Hialeah, which is nearby.
And was it a pretty well attended as it was during his previous campaign, or was there any difference in the number of attendees?
I did not cover that event. I read some press reports the next day, and it did, you know, he had a solid crowd of like his, you know, the MAGA world was out in force for him that night, it seemed. But again, that was just based on my reading of other press reports, not my own coverage.
So what are some of the things that you are concerned about when it comes to health care? What would you like to see the candidates talk more about?
I think that we are in the midst of, when you take a step back just from the presidential race to kind of what's been happening on Capitol Hill with the on again, off again threat of a government shutdown. We've bought a lot more time now into next year. But that does, I guess at some point, the candidate or our leaders will have to make some choices in terms of, you know, you can't just use the discretionary budget to make social riders, you know, to make rules for policies. And that's been one of the reasons why they fight. I think that, you know, they spent some time talking about the fentanyl problem. in our country. And again, I would say Chris Christie and Nikki Haley, everyone agrees. Everyone on the stage was agreeing that this is a problem with border control, because through the border, especially the southern border, but through the borders, we're getting this deadly fentanyl that's killing Americans, the overdoses, and sometimes not even overdoses, accidental use.
Wow.
But the thing that Chris Christie and Nikki Haley said, they talked about that part of it, but they also talked more about the need to address demand, and that there was a need to start treating abuse and to start trying to help people, so that by the time you, if you diminish the demand, you'll also get to the supply side of the problem.
Mm-hmm. I was surprised to see in your article that Christie actually referred to fentanyl or drug abuse as a health issue similar to cancer or any other type of disease. He actually called it a disease, which is, to me, thinking back, years ago, that seemed to not be part of the Republican jargon. They did not usually do that, but he actually stepped forward and actually said that.
Right. I thought that was a pretty important moment.
Wow. So do you think any of these candidates have a shot of closing that gap with the front runner Trump? And also, is Trump's, because of people have their doubts about exit polls and people have their doubts about what, polls really mean when it comes to Election Day, is Trump's lead really as solid as it appears to be? And does anybody have a shot of closing that gap?
Oh, man, I think that those are questions that would require a higher pay grade than mine to really answer. I think he has really solid support right now, but also that's a year away.
Right. Anything could happen.
And so we're going to go a long way between now and then. Lots could happen that could change the calculation, that could change voters' minds. So who knows? I think it could be a wild ride.
What did you learn most about writing the article?
Well, I guess I've been fascinated by the abortion, the abortion debate within that broader debate, and also how that reflects the Republican struggle with the abortion issue. The thing about the debate came the day after the election day was on Tuesday. The debate was on Wednesday, and the Republican, 15-week ban or an anti-abortion really suffered a lot of losses at the polls. I mean, really important. What the abortion rights advocates were saying was a really important ballot initiative passed in Ohio. And Ohio is a red state. In addition, in Virginia, where Governor Youngkin was campaigning really hard on that 15-week ban and hoping to reclaim, he's a Republican, he wanted to reclaim for his party both houses of the state legislature. And they, if my memory serves me, they had one of those. They ended up losing control of both.
Wow. And
then also in Kentucky, the Democrat, Governor Beshear, the incumbent, he came back again. And again, abortion was a big issue in that campaign. So Democrats seem to have more facility on that issue. And Republicans are really struggling to kind of find a way to thread the needle, to be against abortion, but yet not turn off their independent voters and to turn off the people that kind of believe that whole well, I don't approve of abortion or I don't support abortion, but I feel like there have to be some ways, there exceptions. We can't just pretend these problems don't exist.
Right.
So I think that's kind of a really interesting point.
And also
to watch for me.
I think on top to your point as well is that nobody in this country elected anybody in the Supreme Court, and they're the ones that made the decision. So it wasn't as if people voted on this topic, but yet the Republicans are pushing it as if it was something that the people voted for. So there may not be the public support that they think that they have on this, and it could be very divisive and actually a kind of a thorn in the heel of the Republican Party.
I mean, and that a lot of national polls show what you just stated, that the hard anti-abortion position does not have a lot of support. So, but again, it's a poll. So, I don't want to be some expert voice on all of this, because I think that there's a lot of nuance. Mm-hmm. But right now it does seem that people across the board don't really seem to be embracing the hard line.
Was there any moderate voices that you heard on stage at all?
Well, I think that was what was very interesting about Nikki Haley seemed to be the one that was trying to be moderate, and I thought that was interesting. She made no bones about the fact that if she were president and a ban came across her desk, she would sign it. But at the same point, she was the one that was saying, like, practically speaking, Democrats control the Senate. We don't know that we can't pass any. She didn't say that, but the House is so divided. It's hard to pass anything there. The votes in Congress to pass a national ban do not exist. So she was being sort of this practical voice of saying, like, let's find areas where we can have consensus. Like, let's focus on access to contraceptives, on, finding ways to encourage quality adoption, things along those lines.
So do you think at this point we are beyond the challenges to the Affordable Care Act at this point in our political lives? So are they still trying to reform or change the Affordable Care Act? Because I heard there was some kind of talk about Medicare, and then of course on the Democratic side there's this talk about Medicare for all, which I don't know where that's at now.
Yeah, well, this is an interesting point. They did not touch on that at the debate at all. I would say this is at KFF Health News. This is something that we watch, and we've been following the ACA since its inception. And so I would encourage your listeners to check out KFF Health News, because there are a lot of stories on that. I can say it seems like the days of repeal and replace are kind of over now. But that doesn't mean that there aren't efforts. I think that if, within Congress or there are lawmakers that would like to nip around the edges. And there are, to make, instead of making some sweeping repeal kind of effort, there are things like short-term health plans or association health plans, which have always been favorites of the right. Like, they would love to do things that advance those kinds of coverage approaches, which were never included and not approved of by the ACA.
And so in your mind, watching that debate, did anyone win the crowd?
That's hard for me to say, because I wasn't in the room covering it, and so I think that there seemed to be different points when different candidates hit the right tone with the crowd. But the moderators were also really kind of holding things together pretty well, I thought.
Mm-hmm. So if at the end of the day, if Trump actually does walk away with the nomination, provided he doesn't end up in jail first or something like that along those lines, are there things that you see in his position or his platform that would substantially change healthcare or change what we see as health services across the country?
I think that that is yet to be seen. Some of it would be within the implementation of how he executed his efforts. I think maybe on Thursday or Friday, I read a news article about how the thinkers in the Trump world were plotting a way to put a national abortion ban in place without legislation. Like, I'm not quite sure how that would happen, how you could do that. But, he would, depending on what the makeup of the House and Senate is, he would still face those same kind of challenges of, if nothing can pass through Congress, then he can't do it unless he finds an end run on that particular issue. Now, I will say in his previous administration, he did advance some of the, like you asked about the ACA. The Trump administration did loosen some of the regulations that, blocked or I should say tamped down on short-term health plans and some of those other formulations. Now, the Biden administration rolled those back, so it's been kind of a dance. So you could expect, I think, some of those things maybe would be back in style again.
Mm-hmm. So on Biden's side, what is he doing to on the healthcare front? What are his goals with healthcare and the healthcare of American citizens?
Well, I would say again, I would encourage your listeners to check out KFF Health News because there's a lot there on that issue. One of the things that I've noticed right now with a number of our stories, because we are in the midst of open enrollment season for Medicare and also for the ACA. The Biden administration, for instance, has been sort of looking into some fairness issues, I guess is the correct term, having to do with the marketing of Medicare Advantage plans.
Okay.
Just to kind of, because anybody who watches television or, you hear the constant ads. So the Biden administration was making an effort to rein in some of those ads and ask for more accountability in terms of the services that beneficiaries would have access to, and then also to make sure that access continued after it wasn't just something that was talked about during open enrollment, that it continued to be talked about during the regular plan year. So I think they had been doing some things like that. The Biden administration has continued, I think, to work on, supporting the Affordable Care Act. They're in the midst of doing the Medicaid unwinding, which is, from the pandemic rules.
Mm-hmm. Has all that money been spent? What happened to all that? Because there was money left over from the pandemic that wasn't allocated or used. What happened to that money?
That is something I can't really speak to that. Okay. I'm not 100% sure.
Maybe there's an article on KFF Health News, maybe?
I'm sure there is.
We're out of time, so I appreciate your article, and I thought it was a very good read, and also gave me an insight as to the pulse of this country, as to what people are thinking, particularly on the conservative side of things. Love to have you back. Look forward to your next article, and thank you for your time.
Okay, thank you. Have a good weekend.
You too. Happy Thanksgiving.
Okay, bye.